Depression, chronic depression or depression. Depression is an illness characterized by great sadness, a feeling of hopelessness or a loss of motivation. What are the different forms of possible depressive disorders? Its causes and prevalence? And how to get out? Depression, what is it? Depression is a disease that is characterized in particular by great sadness, a feeling of despair, depressed mood, a loss of motivation and decision-making faculties, a decrease in the feeling of pleasure, eating and sleeping disorders, morbid thoughts and the feeling of having no value as an individual. In the medical community, the term major depression is often used to designate this illness. Depression usually occurs as depressive periods that can last for weeks, months or even years. Depending on the intensity of the symptoms, the depression will be classified as mild, moderate or major severe. In the most severe cases, depression can lead to suicide. Depression affects mood, thoughts and behavior, but also the body. Depression can be expressed in the body by back pain, stomach pain, headache. This also explains why a person who suffers from depression may be more vulnerable to colds and other infections, as their immune system is weakened. Depression or depression. The term depression, still taboo not so long ago, is often wrongly used in everyday language to describe the inevitable periods of sadness, boredom and melancholy that everyone is called upon to experience at one time or another, without it being a disease. For example, being sad after the loss of a loved one or having a feeling of failure when faced with problems at work is normal. But when these moods return every day for no particular reason or persist for a long time even with an identifiable cause, it can be depression. Depression is in fact a chronic illness, meeting very specific diagnostic criteria. In addition to sadness, the depressed person has negative and demeaning thoughts. I'm really bad, I'll never make it, I hate what I am. She feels worthless and finds it difficult to project herself into the future. She no longer has interest in activities that were once enjoyed. The different forms of depression. Depressive disorders are classified into several entities: major depressive disorders, dysthymic disorders and depressive disorders not otherwise specified. Major depressive disorder. It is characterized by one or more major depressive episodes, depressed mood or loss of interest for at least 2 weeks associated with at least 4 other symptoms of depression. Dysthymic disorder, dysfunctional and thymia mood. It is characterized by depressed mood present most of the time for at least 2 years, associated with depressive symptoms that do not meet the criteria for a major depressive episode. It is a depressive tendency, without there being a major depression. Nonspecific depressive disorder is a depressive-like disorder that does not meet the criteria for major depressive disorder or dysthymic disorder. This may be, for example, an adjustment disorder with depressed mood or an adjustment disorder with both anxious and depressed mood. Other terms are used alongside this classification from the DSM-IV classification manual of mental disorders. Anxiety depression. Along with the usual symptoms of depression are added excessive apprehension and anxiety. Bipolar disorder, previously referred to as manic depression. This psychiatric disorder is characterized by periods of major depression, with manic or hypomanic episodes, exaggerated euphoria, overexcitement, inverted form of depression. Seasonal depression. Depressive state that manifests itself cyclically, usually during the few months of the year when the sun is at its lowest. Postpartum depression. In 60% to 80% of women, a state of sadness, nervousness and anxiety manifests itself in the days after childbirth. We are talking about baby blues, which lasts between 1 day and 15 days. Usually this negative mood resolves on its own. However, in 1 in 8 women, real depression sets in immediately or appears within a year of birth. Depression following bereavement. In the weeks following the loss of a loved one, signs of depression are common, and this is part of the grieving process. However, if these signs of depression persist for more than 2 months, or if they are very marked, a specialist should be consulted. Prevalence of depression. Depression is one of the most common psychiatric disorders. According to a survey conducted by public health authorities in Quebec, approximately 8% of people aged 12 and over reported having experienced a period of depression in the past 12 months. According to Health Canada, approximately 11% of Canadian men and 16% of Canadian women will suffer from major depression during their and 7.5% of French people aged 15 to 85 have experienced a depressive episode in the last 12 months. 90. According to the World Health Organization (WHO), by 2020, Depression will become the second leading cause of disability worldwide, after cardiovascular disorders. Depression can occur at any age, including childhood, but most often first appears in late adolescence or early. The causes of depression. It is not known precisely what causes depression, but it is probably a